Okay, now I've delightfully wasted time and I have to tell you about Findacure, and really why we should care about it. This is our classic rare disease infographic, which summarises some of the issues that are shared across this wide range of different diverse genetic conditions and non-genetic rare conditions. Generally, a rare disease is defined as one that affects 1 in 2,000 of the general population. That equates to about 3.5 million people in the UK, about 350 million people worldwide. The word rare doesn't really mesh with that kind of number, I don't think. It's a really sizable part of the patient population. The difficulty, though, is that rarity of each individual condition, the fragmented nature of patients. And this can make researching in this area quite tough. We can see that diseases affect about 75% of children, and unfortunately about 30% of those kids will pass away before their 50th birthday. So there's a real range of impacts on patients. For an example of a rare condition, here we have Fibrodysplasia ossificans, progressiva, which is a mouthful to say. This is one of those rare conditions which is really shocking to see. It's one that actually gets some publicity and visibility because of that. It's also known as stone man syndrome. It affects about 1 in 2 million people. Essentially what you're seeing here is the patients end up with flare-ups if they take any kind of physical trauma or damage to their muscles or tissue. Bone cells actually invade that area and form bony growths within the soft tissue itself, so that over life we see the skeleton becomes covered in these lamina of bone. And this essentially begins to fuse the body into a specific position. So it's a really quite horrific condition, highly life-limiting, and you know, has no effective treatment. It does, however, have some quite active and engaged people researching and trying to drive things forward. Despite that, you know, it's still struggling to get the attention and the research that it needs. So this is kind of one end of the spectrum of that rare genetic disorders. On the other end, we have things like congenital hyperinsulinism. So this is Jessica, a girl I met a couple of years back now, who was born with this disease. You wouldn't know that she had any condition whatsoever. It's one of these more hidden rare conditions. It's essentially, as a condition, a failure of the body in regulating blood glucose. The body produces insulin constantly at a very high rate, pulling that blood sugar out of the blood and really starving the brain of food. So babies in the first couple of days will show signs of listlessness. They might begin to have fits. It can lead to brain damage if it's not caught early, and you know, in really severe situations, death. There are some forms of treatment that can work for this, but in the most severe conditions, there's really nothing that can be done effectively for the patients, apart from a near total pancreatectomy. So we remove a vital organ from the body almost completely. So to cure this condition, which is what happened to Jessica, she's been given a very severe form of lifelong diabetes. It's not exactly an ideal therapy to do. So this really just highlights some of the diversity that we see in these rare disorders. I keep pressing the button, I'm sorry. And this diversity, you think, how can we unify rare diseases? How can we form a rare disease? Well, I think there are huge areas of shared interaction, of shared experience, which allow us to bring rare patients together. Primarily, we can see this. You know, there's a huge, long period of diagnosis for all rare conditions. We can talk about an average time of about 4 years for patients to receive accurate diagnosis. We're going through about 3 misdiagnoses, seeing 5 different clinicians to actually get to that stage. That's a very long time to go to actually understand what is going on. We see issues with holding down employment, with education, also because they happen to have the unfortunate circumstances involved with the genetic mutation. And really, at the current rate of progress, it's going to be a very long time, 500 years, until we see active treatments for these conditions. What we do have in the rare patient community, though, is something very special. We have a really informed patient population who are really empowered and determined to deliver change for themselves, and that's really the thing that we like to focus on. So Findacure's vision is bold but quite simple. We want to have a world in which all rare diseases have treatments that are made together with patients for patients. So we want to see patients at the heart of research and development for new conditions and the treatment pathways themselves. And we really believe that kind of collaborative model will help to accelerate treatment development for everybody. One of our primary aims is to help empower patient groups, to help them grow and develop. We do this in a number of ways. We try and run a range of different events that help patient groups to learn the skills they need. So we have things like programs to help patient groups get ready to be involved in research. We want them to help build and grow their charity. We want to support patients and the families, so help them find ways to identify patients that have their condition and provide the support they need day to day. And we also want to help them raise awareness about their rare condition itself, because that ultimately leads to the research attention and the fundraising that they require. We do all this with 4 different projects. We run patient group workshops quite regularly, about 4 a year, which focus on specific topics. People are taught by experts in the area. That might be other patient groups who've gone through certain experiences, people from the pharma industry, or researchers themselves, on things like how to interact with industry, or how to do community fundraising. We have an online portal and webinars, which provide an online way to access some of this information. So if you're a patient group out there that wants to develop the services you're offering, these are ways that you can access it wherever you are in the country or even the world. And finally, we're a peer mentoring program. And this is a scheme where we try and match patient groups up with individuals who've had experience for a year-long period, and they work together to grow and develop their patient organisation. So the peer mentoring scheme has just come to its close of its 2nd year, and it's been a really, quite a successful project. The basic idea here, as I said, is to pair people up with an expert mentor, and they work together on a series of SMART goals for those pairs across the year. Findacure is a charity trying to keep in regular contact with the pairs to understand how they're progressing towards the goals. And they develop, hopefully, a really clear, discrete project that they're working on during that time. During the year, there are 4 meetup events where they can grow and talk about what they're doing. They can meet other people in that peer mentoring cohort, and they also can access some skills training. So this can be general things like time management, or anything really we think is suitable for a whole breadth of different patient organisations. So this year's group were pretty amazing, actually. 16 pairs of the programme, and there have been some absolutely huge achievements. I haven't got a lot of time to give you the full details, but I will to pick up a couple. So one group really wants to focus on young people with their rare conditions. So they've worked with communications consultancy to develop some specific Facebook groups and interactions for different age groups of young patients. So they develop these and are beginning to build young patient communities with that rare condition, which I think is a great achievement. Another group, which have done amazingly, weren't even a registered charity at the start of September last year. They're now a fully registered charity. They've developed a full and complete scientific advisory board. They've run a launch event for the charity with the scientific advisory board and as a first point for patient meetup. When they started out, they were told that there were 6 families affected with a rare condition in the UK. They've actually already identified 30 different families that are affected with this condition. So really helping to move things forward for these patient groups to move forward. The other thing we do is try and promote collaboration, build rare communities, and ultimately hope to develop new treatments. This is one example of those events. We run a conference annually. We're trying to run these showcases, which are highlighting the great work we've done around the UK. We've been to Cardiff this year. We have our conference in London. We run events in Cambridge, our hometown. Last year we were in Birmingham, and now we're very pleased to find you from the northern part of the country in Newcastle. And we're hoping to move around even further, hopefully heading to Glasgow next year, possibly moving into Belfast and Bristol moving forward. And the aim there really is to connect everyone together and bring new people to areas as well as showcasing the work that we've done. Everything here is about collaboration. There's a huge number of different stakeholders who can make a difference to patient care and developing effective treatments for rare disease. And we want to make sure all of the people who are in the room are not just talking about what they can do, but how they can work together and interact together. That kind of collaboration really gives us a good chance to move things forward in rare diseases. And part of what we do, therefore, is drug repurposing. We're trying to develop a new way to promote the repurposing of existing drugs into rare conditions. So what exactly is repurposing? It's really just recycling. It's trying to find new ways to use existing drugs to treat rare conditions. What we want to do is use clinical trials to do that. We want to actually run clear, evidence-based clinical trials to test the effect of these drugs in new patient populations, hopefully making more efficient use of our existing medicines. We've done recently a review of drug repurposing. This is something that's ongoing, trying to see how much of this is currently being used in the rare disease space. Our perception is happening a lot. What we've found so far is 167 different cases, different examples of rare diseases paired with a new repurposed drug, which is a really encouraging sign. And that's actually only going back as far as 2008, so a huge amount of literature has been produced around this idea. And from these numbers down here, what you can see is that most of this literature is kind of in the off-label case study space. This is individual clinicians trying out ideas, this is researchers testing ideas, but not really progressing through to the full clinical trial stage. So we do need to move to a point where we can have more clinical trials there to develop and show the efficacy and effect of these repurposed drugs. Why repurpose? Essentially, you're working with what you know. This allows you to do things more quickly and more cheaply. And when we're dealing with really complex patient populations or diffuse patient populations like a rare disease, that can only help. You remove the need for de novo drug discovery. You also know something about the safety profile of the drug you're repurposing. If it's a generic drug, you have a long history of human use, and that human use will be in different populations. It might be in kids, it might be in older people, adults across many different conditions, and that tells you about how a whole range of patients react to that drug. If that's the case, you can use that data, that historical data, as evidence about the safety of the drug. It can reduce some of the requirement for early-stage clinical trials. You also know about the pathways of action of the drug, and this really makes things much easier in identifying potential repurposing candidates. If you know how your drug works, how your rare disease works, you know how your drug works, you can pair things together, so you're not screening thousands of drugs, you can screen one or two useful, potentially effective compounds. Of course, funding repurposing is always the challenge. It should be really appealing to repurpose generics, but unfortunately, there are issues of IP. If anyone can make a drug, pharmaceutical companies are slightly concerned that their huge investment into developing a new agent for a new condition will be hard to recoup. So this essentially means we don't see a lot of pharmaceutical companies working in the generic drug repurposing space. But we think at Findacure this could be an area that patient-led innovation and academic innovation can really move things forward to develop some much needed treatments for rare conditions. So an example of that is the AKU Society, and Leslie from AKU is here today, and I'm happy to talk you through this story at the stand in the group. Essentially, AKU is alkaptonuria, otherwise known as black bone disease. And this condition essentially is all about the build-up of homogenetic acid within the body. This attacks the bones and cartilage, turning it black. But more worryingly, it really leads to an early form of osteoarthritis. So it's very unpleasant, it leads to lots of joint replacements for patients. What Professor Ranganath noticed, along with the people at the AKU Society, was that this drug Nitisinone, which is approved for a completely different rare condition, works on the same pathway as the homogenetic acid pathway. It actually stops the build-up of homogenetic acid. So, in theory, if you prescribe that drug to those patients, they should be in a much better position where they're not producing the acid, they're not therefore suffering the symptoms. So what the AKU Society went out and did is form a massive international collaboration with people in France, Slovakia, academics, pharma companies, really patient-driven, and essentially raised about £6 million funding from the EU to run a clinical trial. They completed the phase 2 study, they're halfway through the phase 3 study, and things are looking really positive to actually get this drug repositioned for an ultra-rare condition based on patient engagement. So it's a great example of what can be achieved. What we want to do is set up our own way of funding things. This is our rare disease drug repurposing social impact bond. I'm going to go through it very swiftly. Feel free to ask me about it. Essentially, what we're trying to do is get investors to put money into our bond. What we want to do as a charity is draw those funds to invest in phase 2 clinical trials that are focused on repurposed drugs. We want to try and target rare conditions that currently cost the NHS a lot of money to treat or manage. They're not really addressing the underlying condition, they're just spending money to manage those symptoms. What we can do then is if those trials are successful, we think there'll be evidence presented to prescribe a low-cost generic drug to treat that condition within the NHS. So we should be improving the patient health outcomes, reducing NHS spend on managing the condition, and actually doing that at a very low cost for the drug itself. So that should save the NHS money. That should make them very happy, right? Save money, improve patients' lives. With that, what we want to do is ask the NHS to repay a small amount of money they save back into our social impact bond. This generates some returns for our model. We can therefore pay some money back to our investors, return their investment, possibly pay us some profit if that's suitable. And with any leftover money, we can then reinvest that in further generic drug repurposing clinical trials. These will be relatively small, academic drug driven, with a certain potential to make some difference with this model. Essentially, we're generating returns from healthcare savings, and if we're successful enough, we have a self-sustaining system here that doesn't need further investment. This is what we're trying to develop and we're working on for the rest of the year or so. We've been working to prove the concept in a number of different ways, which I'm not going to go into right now, because I want to keep us on track today. Suffice to say, we've been talking to patient groups about their needs, and we've been developing health economic models to really try and show the cost of some existing rare diseases is high to the NHS, and there's money to be saved, and that by repurposing a drug, we can actually save enough money to fund the clinical trial. And the results are briefly summarised here in 3 different rare conditions we've worked on. What you can basically see here is the cost to the NHS for a year to treat these 3 different rare conditions. These are not big sums for the NHS, but they are big sums for rare conditions themselves. Wolfram syndrome is about 60 patients in the UK, spending just under £1 million per year to deliver essentially care and monitoring for patients. Really important for patients, it's not modifying the underlying condition. that is amount of money that can be saved. And over here, we're seeing money that we think we can recoup from our social impact bond model over a 5-year period. This type of fund, this type of money, if given to an academic research lab to run, or an academic clinician to run a clinical trial, would be more than sufficient to deliver a lean, rare disease, patient-focused clinical trial to prove the efficacy of these conditions. So based on this, we really think the SIP can work as a great model for rare diseases. So in summary, as a charity, we're really focusing on the patient experience and trying to help patient groups grow to support their patient communities. We want to build a wider rare disease community, and we want to try and run events that can improve the skills of those patient groups, but also give them a chance to meet other people in the rare disease area, whether they are other patient groups or researchers, clinicians, and the pharmaceutical industry. And we're trying really hard to work with the NHS to develop new methods to fund repurposing to deliver low-cost treatments for rare diseases. Thank you very much for your attention. Thank you so much for coming along to attend today. We're really excited about the day, and hopefully it's something that you'll